Pill shaming. Is that a thing? If you've been involved in any social media conversations around mental health and medication, you've probably come across this pill shaming hashtag. Many times people use it to discuss the experiences they've had and telling people their decision to get on psychiatric medications only to be discriminated against. Maybe someone assumes that they're just malingering and that they need to get out and get more fresh air and sunshine and go for a walk. Or maybe somebody is saying that they shouldn't take it and need to try these alternatives, not realizing that those alternatives had already been tried unsuccessfully. Or it could be a romantic interest who says they won't date somebody taking psychiatric meds. Whatever it is, it's unfair, and I feel for those people that this happens to. But unfortunately, the pill shaming hashtag can also be used as a bludgeon to silence people who are taking these meds or who have stopped taking them and have had a negative experience. Pill shaming goes the other direction. For these people, it can be somebody going into their doctor and saying, these drugs don't work for me and I think they're making me worse and I want to stop taking them. And then their doctor says, well, that's just a symptom that your underlying condition is getting worse and that you should keep taking these and never stop or take more. Pill shaming can be an industry that is so bad at recognizing this problem that they only focus on getting people on these drugs. And so when people need to stop taking them, there are no medications that can be safely and slowly tapered off of. Pill shaming can be doctors who are uneducated, most of the time through no fault of their own, because there is no research into this problem. That means that these doctors have access to zero research on how to safely taper somebody off of medication or how to help them after they get off when they are injured with a central nervous system and brain injury that is so debilitating many of these people can't even work. Pill shaming might even be somebody who doesn't want to get off of their medication, but because their psychiatric drug is a controlled substance, their doctor decides without their consent to withdraw them. And when that person has difficulty withdrawing or being off, they're accused of being an addict, even though they've only ever taken this drug as prescribed. And pill shaming can be telling people to be quiet, to shut up, because their story isn't true or because it's so scary that it could be harmful to other people and that they need to stay silent. Unfortunately, we saw this with the Royal College of Psychiatrists when they came out with this big study that talked about how well antidepressants worked and if anything, they should be prescribed more, and that the side effects of withdrawal were only a few weeks and minimal. When many patients began to reach out to these psychiatrists saying this was not their experience and that the side effects could be devastating, lasting months or years, leading to a disability that was so severe many people couldn't work and their families didn't understand, and so marriages and families were broken apart, people lost their homes, and many people often died from this condition. Instead of listening to these patients, these doctors went onto their website and removed a survey that corroborated what these people were saying. They gaslighted their own patients and made them disappear. Isn't the End the Stigma and the pill shaming hashtag really about making sure that people aren't ashamed to tell their stories and receive equal and fair access to the medical treatment that they need? How do we have this conversation? I realize it's a difficult conversation to have. What doctor wants to admit that they might be injuring many of the people that they've been trying to help all these years? What if you're somebody who really enjoys eating cereal in the morning or likes to have dessert after your dinner at night? And you've got a friend who's really into eating healthy, like paleo or Atkins or something like that. And they point out to you how much it's helped them to not eat carbohydrates or grains. And they show you studies that show that maybe some of the health problems you're dealing with are related to the foods that you're eating. Is that considered carb shaming? Is anybody saying that people who eat wheat are bad or somehow dumb? Or that wheat should be eliminated from off the face of the earth? I mean, there may be a few fanatics who talk that way, but that's not really the focus of the conversation. The conversation is, let's look at all the information and take that to help this person make the best decision for their own health and to help society at large. But we can't have that conversation if we don't have the information. And silencing the people who are on the other end of that spectrum is denying people the ability really to make informed choices. Much of the information about these drugs is incorrect, is false. Many people take them because they believe they have some sort of a chemical imbalance, that they're low in some chemical, and these drugs correct that, and that's simply not true, and that falsehood has actually hurt many, many people. So let's have this conversation. Let's keep it real, and let's keep it respectful. But make sure that everybody has a seat at the table for this conversation, because really what we all want is to make sure that everybody is helped. But we should also be ensuring that we help as many as people as possible, while at the same time injuring as few people as possible in the process. And please, whatever side of the conversation you're on, let's not use the pill shaming hashtag as a weapon to further harm people who have already suffered through so much.